Imagine working in a profession where you are responsible for the health and well-being of others, but completely neglecting your own. As nurses, we are on the front line every day, but when was the last time you checked in with yourself? Let's face it, the expectation to always power through while putting others first is not just unhealthy, it's a ticking time bomb. Today we are going to challenge that mindset. Why is it that as healthcare professionals we often forget to care for ourselves, and more importantly, what happens when we finally prioritizing our own well-being? It's no secret that nursing is one of the most demanding professions out there. Long shift, emotional exhaustion, and the constant pull of patient care are daily realities. But here's the twist. None of that will change if we keep neglecting ourselves. Self-care isn't selfish, it's essential. In fact, it's the key to being an effective nurse, not just today, but for the long haul. I remember vividly a moment not too long ago when I found myself on the brink of burnout. It was during one of those back-to-back shifts in the ED where the patients just kept coming. The workload never eased up and no one had time to sit down for lunch. I felt like I was running on autopilot. My body was moving, but my mind was elsewhere, almost numb to the surrounding chaos. I'd dismiss the growing exhaustion for weeks. I'd ignore the nagging tightness in my shoulders, the headaches, and the constant fatigue. It wasn't until a colleague pulled me aside that I realized how far I let myself go. She said, "You don't seem yourself lately. Are you okay?" And that simple question hit me like a truck.
Did you get the license number of that truck that hit me?
It made me realize while I'd been hyper-focusing on everyone else, I had failed to take care of myself. That's the problem, isn't it? We often wait until someone else notices the signs before we even acknowledge them. But what if we didn't wait? What if we started recognizing our own need before reaching the point of no return? Taking care of yourself means paying attention to those little signs your body is sending. It means allowing yourself the space to rest, to recharge, and to recover. If you're constantly drained, how can you give your best to your patients? The truth is you can't. Self-care doesn't just benefit you, it benefits those you care for. So where do you start? It begins with small steps. First, let's talk about boundaries. Those invisible lines we often struggle to enforce in nursing. We are often taught that going the extra mile is part of the job. But if we're not careful, that extra mile turns into a marathon without an end. It's critical to recognize that saying no when necessary is not a weakness, it's survival.
I don't want to do it and I'm not going to do it.
In my own practice, I used to be the nurse who said yes to everything. Extra shift, yes, come with it. Covering for another, come with it. Taking on the most challenging patient, alright, I'm there for it. It felt good in the moment, like I was contributing something meaningful. But over time, I noticed I was running on fumes. I'd come home utterly exhausted, snapping at my loved ones and feeling too tired to do anything except collapse into bed. That wasn't fair to me or anyone around me. One day I finally did something about it. I began to set firm boundaries. If I wasn't physically or emotionally available for an extra shift, I simply said,
No, I'm not doing it!
It felt strange at first, almost like I was letting someone down. But over time it became liberating. I found that when I set limits, I was able to give more to my patient during the shift. I wasn't running on empty anymore. Another piece of the puzzle is rest. And not just sleep, but real restorative rest. We are all guilty of scrolling through our phones or watching Netflix when we're exhausted. And we have a tendency to convince ourselves that this is a downtime, but true rest is deeper than that. It's about disconnecting from the constant noise and giving your mind and body a chance to recover. I remember one weekend I had planned to catch up on some administrative work because I have plenty of administrative duties, so I need to use some time for them. And I thought of preparing for the upcoming week. But instead I decided to go for a long walk by the beach, a place I hadn't visited in months. I left my phone behind for a few hours. I allowed myself just to be present. The impact was immediate. When I returned to work that Monday, I felt a noticeable difference in my energy levels and my mood. That experience taught me that self-care doesn't always have to be a grand gesture. Sometimes it's the simple act of giving yourself permission to step away that can make the biggest difference. Let's also talk about mental health. Nursing takes a toll not just on our bodies but our minds as well. The emotional weight of seeing patients at their most vulnerable, sometimes even at the end of their lives, can be overwhelming. Yet we rarely talk about it. The unspoken expectation that we should be able to handle it. But let me tell you from experience, no one is immune to the emotional impact of nursing. I once had a patient I grew particularly attached to. He was a long-term case, in and out of the ED for months, and despite our best efforts, his health continued to deteriorate. When he eventually passed, it hit me. I remember standing outside the hospital, staring into the distance, feeling a profound sense of loss. And yet I had no idea how to process it. It wasn't until I spoke to a counselor that I realized how much I had been holding in. That conversation was a turning point for me. It made me realize that taking care of your mental health is just as important as taking care of your physical health. Seeking support, whether from colleagues, friends, or professionals, is not a sign of weakness, it's a sign of strength. Nurses, more than anyone, knows the importance of asking for help, yet we rarely do it for ourselves. But here's the thing, you can't pour from an empty cup. To care for others, you have to care for yourself first. And let's not forget about nutrition. I know, we've all heard the lecture about eating right, but the reality is, it's hard to make healthy choices when you are grabbing a quick bite here in between shifts or scraping down whatever is left in the staff lounge. But here's something I've learned. What you fuel your body with directly impacts how you feel, both mentally and physically. And when I started in the ED, I used to run on caffeine and sugar. I'd grab a quick snack thinking it would give me the energy I needed to power through the next few hours. But instead of feeling energized, I often felt sluggish, even more tired than before. It wasn't until I started paying attention to what I was eating that I noticed a difference. Swapping out junk food for nutrient-dense snacks didn't just give me more energy, it also helped me feel more focused and less irritable during those long shifts. And finally, let's talk about the importance of connecting with others.
Do I have to do it all now?
Nursing can be an isolating profession. At times, even when you are surrounded by people, you're constantly giving a part of yourself. But how often do you receive support in return? Building a network of fellow nurses, friends and family members who truly understand what you're going through can make all the difference. For me, it was joining a group of nurses who met outside of work for a casual meetup. We didn't talk about patients or cases, we just relaxed, shared the fun stories and supported one another. It became a safe space where we could vent, laugh and recharge. That community became my lifeline during some of the most stressful periods in my career. So how do you prioritize your well-being as a nurse? It's not about finding massive chunks of time to devote to yourself. That's often unrealistic. It's about integrating small, meaningful moments of self-care into your daily routine, setting boundaries, seeking support, nourishing your body, resting properly, and building connections. These are the steps that will not only sustain you, but make you a better nurse in the long run. And speaking about becoming a better nurse, this video will also help you become a better nurse. At least that's what YouTube thinks. So check it out, and I'll be seeing you right over there.